Dr. Rafage, Vet Triage. This will be posted on January 24th, 2025. We're going through this issue of JAVMA. It is the March 15, 2017 issue. We are doing another pathology in practice. There it is. That is a picture of a 2.5-year-old German Shepherd with a large draining wound on the left elbow. The dog was evaluated for swelling of the limb, tongue, periocular region bilaterally of about 1 month duration. This dog had painful ulcers on the elbow, the left elbow, the right forepaw, the lingual area, and the dog's appetite decreased over 2 days. The dog on physical exam was febrile, tachycardic, tachypnic, recumbent, unable to stand, swollen joints, painful joints, pitting edema of the limbs. CBC showed an inflammatory leukogram, but could be a stress leukogram as well. Had a left shift. There was mild hyperglycemia, mild hyperglobulinemia. Cystocentesis showed normal specific gravity with 2+ bilirubin, 3+ heme, and 3+ protein. That was a cystocentesis. They did a fine needle aspirate of synovial fluid from the left elbow joint. That picture down below is an x-ray image showing you the elbow joint of a dog and where we were going to insert the needle. Obviously, it's not as straightforward as that, but that's to give folks an idea of what an arthrocentesis is. And we collect the fluid and we submit it to the lab for testing. The fluid in this dog was cloudy and red. It had a nucleated cell count of 4 × 10⁻³ cells per microliter. Synovial fluid samples from normal dogs typically have less than 3 × 10⁻³ nucleated cells per microliter. The packed cell volume was less than 3% of this fluid. The protein was not measured because of insufficient volume of sample. When they submitted to the lab, the nucleated cells were primarily non-degenerate to mildly degenerate neutrophils, approximately 70%, which usually, if you have over 50%, typically 70-90% neutrophils, you think about usually infectious causes. It could be also due to immune-mediated causes, but typically with immune-mediated, you're looking for way more mononuclear cells like macrophages more than neutrophils. But depends on what stage of the disease you're talking about. This one had lymphocytes that were 15% and large mononuclear cells at 15%. The neutrophils, 30% contained pink cytoplasmic inclusion. The pink inclusions were round, ranged in diameter from 2 to 4 micrometers, had a homogeneous smooth appearance, and had peripheralization of the nucleus. These features were consistent with nuclear material indicative of lupus erythematosus cells, or LE cells. No microorganisms were identified, and that's in the thumbnail, is that cell there. That arrow is pointing to the nuclear material, and it's pushing that nucleus, which is the dark purple, it's pushing it aside in that cell. And so that is an LE cell from the synovial fluid, a lupus erythematosus cell. And then they did an anti-nuclear antibody test, which was positive in this dog. He actually had a very high ANA, anti-nuclear antibody test, of 1 to 5,120. So this was a diagnosis of systemic lupus erythematosus in a dog, or SLE. SLE is a rare prototype of multi-organ autoimmune disease. There's genetic and environmental factors. There's also problems with the innate and adaptive immune system. It affects middle-aged, medium to large breed dogs. It's also associated with polyarthritis, glomerulonephritis, skin lesions, hemolytic anemia. It's seasonal, being seen in the summer and the fall. Lupus erythematosus cells are neutrophilic phagocytes that contain intracytoplasmic hematoxin bodies of nuclear material. The hematoxin bodies are believed to be formed from the opsonization of nuclear material, which leads to neutrophil engulfment, thereby creating lupus erythematosus cells. In people with this disease, these cells have been detected in pleural effusion, bone marrow, synovial fluid, cerebrospinal fluid, and pericardial fluid. In dogs, we diagnose it typically from having at least 2 clinical signs and a positive ANA. The ANA test detects antibodies to the patient's serum that reacts with the nuclear antigens. A study found that 95% of healthy dogs were considered negative for anti-nuclear antibody only after a serum titer dilution of over 1 to 100 was used as the cutoff value. Another report said that a diagnosis of systemic lupus erythematosus should be considered either when the serum anti-nuclear antibody test is positive at over 1 to 640, or when the patient has a lower ANA at over 1 to 160, but at least two major clinical signs. These major clinical signs include skin lesions, polyarthritis, hemolytic anemia, glomerulonephritis, proteinuria, polymyositis, leukopenia, or thrombocytopenia. With the HEP-2 substrate for anti-nuclear antibody testing, a dog can be considered positive for SLE when the anti-nuclear antibody are detected at serum dilutions of at least 1 to 100. A study showed that different nuclear fluorescence patterns may be associated with different systemic autoimmune diseases in dogs. Dogs with homogeneous nuclear or chromosomal staining had several major clinical signs that highly correlated with the diagnosis of systemic lupus erythematosus. Speckled nuclear staining was more common in dogs that had restricted clinical signs, including musculoskeletal disorders, fever, and fatigue. It is possible that speckled nuclear staining pattern is evidence of systemic lupus erythematosus-related diseases, which may be associated with different immunodiffusion subgroups. The differentiation of these nuclear staining patterns is generally difficult when they use rat liver tissue as a substrate for the anti-nuclear antibody testing. The prognosis is variable with relapses to be anticipated. There is a correlation between ANA positive results and clinical behavior. And like I said, this dog had a 1 to 5,120 ANA, so really high. Immunosuppressive doses of glucocorticoids, maybe with combination of cytotoxic drugs can be used, like levamisole. And it seems that the combination is more effective than just oral corticotherapy alone. You can also consider plasmapheresis and low-dose immunosuppressive drug treatments. With this dog, after 13 days of treatment, the ANA was still positive at 1 to 640. The dog failed to have improvement clinically, and they euthanized him. So these immune conditions are one of my favorites, not because they're poor outcome, obviously, but because they require workup, and they can appear as anything. It's kind of like cancer. Immune-mediated disorders can appear as many different types of clinical manifestations. So you have to always keep in the back of your mind that immune disease might be a differential. And so, yeah, it's pretty wild, this condition. But good report. They were fairly thorough with it. And then we'll see you guys again tomorrow for another one. Take care.